This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted you're with us today, and we truly are going to talk about the human side of healthcare today, Thomas. We're going to talk about a subject that is all over the Metroplex, but especially is in areas in certain zip codes. Asthma.
This is a big story because it's widely known around the country that Dallas-Fort Worth area is bad for allergies and asthma. And so this affects a lot of us, but it also affects a particular demographic especially.
You know, you're right, and this reminds me of the story that Dr. Steve Miff told us about, where a patient actually had asthma. His mother lost her job, couldn't afford the medication anymore. He had been very active in extracurricular activities at school, but because his asthma attacks became more frequent, he dropped out of those extracurricular. He fell into the wrong crowd and unfortunately participated in an armed robbery and was shot with a gunshot wound to the chest. But his mother told the doctor he really died from asthma. Such a touching story. And we're going to talk to Dr. Cesar Termulo, who's a physician at the Hatcher Station Health Center with Parkland Health and Hospital System, and he treats these patients every day. Dr. Termulo, welcome to the show.
Thank you very much for having me, and it's a delight to be on your show.
You know, a lot of our listeners, I know, have heard about asthma, but maybe they don't really understand the medical definition. Can you tell our listeners what is asthma?
Sure. Asthma is a chronic or long-term respiratory condition where your air passages in your lungs are extremely sensitive such that the air passages oftentimes swell up and even close to a point where it causes difficulty breathing, and it can cause cough and difficulty breathing. There's a spectrum of symptoms that can occur with that. It could just be a mild symptom where you just have a little bit of cough, a little bit of chest discomfort, and it could be all the way to your air passages in your lungs react such that your air passages close, almost completely close, where you can't breathe. You breathe very quickly. You have a hard time getting in air when you breathe. You breathe quickly, which we call shortness of breath, and you can even hear like wheezing in the chest. So there's a wide array of symptoms of asthma, but it all starts with a little bit of sensitivity or hyperreactivity of the air passages in your lungs.
Do we know what causes asthma?
For every person, there is a slight difference in what causes it. For some people, it could be an allergy. It could be an allergy to common pollens in the air, such as grass or ragweed. For some people, it could be exposure to things like smoke in the air. For some people, it could be a regular infection. Oftentimes in kids, they start with just an upper respiratory, just runny nose, and just a regular respiratory virus, but then it causes a reaction in the lungs where one gets an asthma attack.
When we think in terms of social drivers of health, it's my understanding that many minorities have a much higher incidence of asthma than whites. In fact, it's my understanding that African American children with asthma are 5 times more likely to be admitted to a hospital than white children. And many African American adults are much more likely to develop asthma than whites. Is that true?
I would say that's 1,000% true. And a lot of it, part of it is genetic, in that there's a genetic component to asthma. It does run in families. But a large part of it are these socioeconomic variables that the African American population has to deal with that oftentimes the Caucasian population does not have to deal with. We're talking about things like living conditions. So as I mentioned, that certain allergens might trigger an asthma attack. We're talking about things like mold. We're talking about things such as smoking, even dust mites and cockroaches, which I did mention those, but those are factors for asthma. So if one is living in crowded, more difficult living situation, then one is at higher risk for asthma. So and it's not only the socioeconomic conditions that the African American population deals with. We also have to talk about accessibility to healthcare and accessibility to primary care physicians. Because one thing about asthma is that it requires chronic disease management. It requires ongoing tweaking of medications. It's not just simply start one asthma medicine. It's also a frequent checkup with their primary care physician who can monitor even those subtle symptoms of asthma that might require extra preventative medications and therapy. So if there is a lack of access to primary care physicians who can do chronic, frequent, ongoing care of asthma, then one's asthma can be more prone to an asthma attack.
In several of your answers, you've referenced asthma attack. For our listeners, can you explain what an asthma attack is?
Sure. One of the difficulties in talking about asthma and educating people about asthma is that people only see asthma in terms of the outright asthma attack. And what I mean about that is that when the airways in your lungs have almost completely clamped down, okay, and the little, by air passages, I mean these big tubes in your lungs that carry air that you breathe in, and it transfers to the bloodstream in the lungs. And so with an asthma attack, these air passages have almost completely kind of constricted. That's when your symptoms are very noticeable. So severe cough, you can hear wheezing, you have shortness of breath, and people are breathing very quickly. Sometimes you can turn blue. So those are the prominent symptoms of asthma that can cause an asthma attack, and people recognize that when those things happen, you need to go to the ER, okay? But one of the issues with asthma is that there can be, especially with pediatric asthma, there can be very subtle symptoms, which is not an outright asthma attack, where the air passages may be closing a little bit and it just causes a little bit of a cough. And that's it. And it would be difficult to distinguish between a mild asthma attack and perhaps allergies. So an asthma attack is essentially when everything shuts down. But you can also have mild symptoms of asthma that might not be perceived as an outright asthma attack, but in fact still need treatment. And that is the difficulty with taking care of asthma, especially in areas of disparity, because if they don't have easy access to healthcare, it's hard for them to distinguish when they're having even a mild asthma attack, because most people can notice the severe asthma attack. But the question is that there are mild asthma attacks that need to be taken care of that people don't recognize.
We're listening to Dr. Cesar Termulo. He practices at the Hatcher Station Health Center, which is part of Parkland Health and Hospital System. When we come back, we're going to tackle adult asthma, breathing problems, allergies, asthma in adults as well as kids in Dallas. Oh, you bet. And we'll talk about it next. Coming up on the human side of healthcare. Stay with us.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome back. Asthma and breathing problems in North Texas. Oh yes, widely known as being a problem in this part of the country. We're talking with Dr. Cesar Termulo, a pediatrician with Parkland Health and Hospital System.
So it sounds to me as though asthma can be treated, one, when you have an asthma attack, as you said. Hopefully you will have access to care like an emergency room, and I assume there's rescue medication. But then the ongoing treatment of this chronic illness.
Correct. And, I'll have patients who come into the clinic, and they might be coming for just a regular checkup, and they might be having just a little bit of a cough. But in reality, when I examine them, they might be having a little bit of wheezing, a little bit of cough, and actually they're having symptoms of asthma. And it's what it triggers for me as a physician is to number one, we have two different kinds of medications. We have rescue medications when one is having severe symptoms of asthma, such that we call that medicine albuterol to open up the lungs. But in addition, there are some preventative medicines that could be given on a long-term basis to condition the lungs so that they don't go into asthma attack. And so when that patient who comes in that might have just a little bit of symptoms of asthma, that triggers me to start that medication to prevent asthma. So so that's an example of some fine tuning that takes place on just on a daily basis for these patients that come in that might have asthma. But as I said before, a lot of these are symptoms that aren't easy to recognize and distinguish between things such as allergies or things like a simple cough from a respiratory virus.
And I know that we've talked about asthma, and we've mentioned, obviously, children, adolescents, and adults. Here's a real curious question. If you went through your childhood and really didn't experience problems with asthma, as an adult, can you develop asthma?
That's an interesting question because a lot of patients come in to my office, and keep in mind I'm a pediatrician, so I'm mainly seeing the child, but often the parents say, oh yeah, my asthma went away, or I didn't have asthma as a child, but all of a sudden I come to Dallas and I have asthma as an adult. There could be a couple of reasons for that. Number one is oftentimes, as I mentioned, sometimes there are some people that have mild symptoms of asthma, but if they're not going to the doctor, they might just be living with asthma. And then let's say someone starts smoking as an adult, and then that exacerbates their symptoms of asthma. So it might have been that they had asthma as a child. It wasn't as noticed or wasn't diagnosed as asthma, but then they start smoking as adults, and then things get worse, and then you really notice the symptoms of asthma, and then one might think that I didn't have asthma as a child and I developed it as an adult. Another possibility is, let's say someone, as I mentioned before, sometimes asthma is very individualistic. So if one's asthma is triggered by certain allergies, and let's say you live somewhere and then move to Dallas where there's tons of environmental pollens that can trigger an asthma attack, and then it might be perceived as an adult onset asthma. So lots of times that's how asthma can be developed as an adult, but oftentimes it might have been silent, like low baseline asthma that kind of gets noticed more in adulthood.
You mentioned smoking, and I know you indicated that you're a pediatrician. Children or adolescents that vape aggravate their asthma.
Yes, the literature is coming out now about that, since vaping is more prevalent in the last few years. But yes, vaping can cause asthma attacks, and what we found is it causes much more damage to the lungs in terms of the protective lining in the alveoli, the end sacs of the lungs, that can actually cause much more severe disease. Depending on what is being mixed in the vaping substrates, and a lot of times what is being vaped are unknown chemicals that are not regulated, it can cause much more severe damage to the lungs.
I know Parkland conducts a community health needs assessment, and one of the issues they found that there's high asthma morbidity among pediatric populations in certain parts of Dallas County. They even drill down by zip code. Can you talk a little bit about these areas in Dallas County?
Yeah, personally, I'm so glad that we performed this community health needs assessment. And for the listeners out there who might not be aware of what that is, with the Affordable Care Act, certain public institutions, public hospitals must perform a community health needs assessment every 3 years. And what we found is that there are significant areas of disparity in certain populations in Dallas and certain zip codes. So Parkland has put together a lot of resources behind trying to reach out to certain zip codes that are more high risk for asthma. So we're have a multi-pronged effect using technology in addition to boots on the ground, trying to find populations and sectors of the population that have asthma. It's very interesting because where I office and where I see patients is in the Hatcher Station Health Center in Fair Park, which is right at the 75210 zip code. It's an area of high disparity, yet oftentimes a lot of the community in the area might not necessarily come to our clinic. We have a lot that come to our clinic, but it was interesting because we have regular meetings with a lot of the school nurses in the area, and they relayed to me that a lot of their students, they'll come to the school clinic in an asthma attack, and the reason is because they haven't been going to PCP, they've not been utilizing primary care, and so there's pockets of patients out there that are not receiving any primary care despite having clinics such as Parkland in the area. So what we're trying to do from a system is trying to collect high-level data from things such as our electronic medical records, looking at patients who might be out there that have been lost to follow-up, or they might have been going to the ER but not go back to their primary care physician. Also trying to use the FW Council Hospital data to look to see which patients might be showing up at ERs and trying to find out, trying to geomap where those people are that might not be utilizing primary care. And then we're going to try drilling down from a high level to know which sectors of the population might not be utilizing primary care, and then trying to go out to those pockets of the community that might need assessment. We are working with folks such as the Dallas County Health Department. If we can find out which pockets of the population might be at risk for environmental issues such as mold and smoking, crowded living conditions, Dallas County is going to do home visits to certain areas to see what factors are putting people at risk for asthma. We also are working closely with someone called Shamara Norris. She's director of positive breathing. Basically what that is she has a mobile van, and she will go out to an apartment. She will go out to a rec center, and she will go out and do asthma testing called spirometry to assess their level of severity of asthma. And then once that population has been screened for asthma, they can then be referred into our Parkland clinics.
You mentioned when we started talking about asthma, obviously some is hereditary. We talked about some of the minorities, but you also talked about the environment, where the children live. If it's damp conditions, if there's mold, if there's mildew, if there are cockroaches. Have you ever looked to see how much environment impacts asthma? 40%, 50%? Or have you done that kind of detailed study?
Well, I know that there are organizations out there, myself as a clinician out in front seeing patients, haven't done much of those studies, but we will be working with the Dallas County Health Department. Waldo Almanchola is in charge of a group of community health workers that will be going out to houses, that will be looking at things such as the condition of the apartment, possibility for mold, the air quality as well. And so we'll be gathering some of that data from going out firsthand. We're putting the program together right now, so we'll start to gather the data from here going forward.
Great information. Dr. Cesar Termulo, pediatrician at Parkland Health and Hospital System, thank you so much for that information on asthma, which is a big deal all over North Texas. I'd like to slip in here about our podcast. We have all of the episodes on the human side of healthcare on podcasts. It's just by that name, obviously, and it's on all the major podcast players wherever you get yours. We are there. Now, when we come back, we're going to talk to a pharmacist. Did you know that a pharmacist is a wealth of information? We're going to stay with the Parkland Health and Hospital System and talk to Cortny Anderson. She's a PharmD and is the Ambulatory Pharmacy Manager. And for those of you who might be interested in careers in medicine and pharmacy piques your interest, stay with us because she'll be talking about that as well. Cortny Anderson, pharmacist, next on the human side of healthcare.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome to the human side of healthcare. Today we want to talk about a topic of talking to your pharmacist, getting advice not only on medications that you take, but medications and how they interact with other medications. We're delighted we've got Cortny Anderson with us today. Obviously, she's a pharmacist and she's in the ambulatory clinic at Parkland, and she's actually the pharmacy manager for Parkland Health and Hospital System. Cortny, welcome to the show.
Thank you. Thank you for having me.
You know, I think sometimes people don't stop and think, a great resource is their pharmacist. Why is it important to talk to your pharmacist first about all your medications and even include supplements?
Great question. So I think it's very important to talk to your pharmacist because they have a broader view of your medications than I know a lot of times we visit our doctor and they may be specialized in one area, but your pharmacist knows a lot about a lot of drugs. And so they can take a wide profile view of the medications that you take and evaluate them on a higher level and make sure there are no interactions. And like you mentioned, it's important to mention your supplements because those, whether that be an herbal product, can interact with medications and you may not know about that. So it's very important to let your pharmacist know about that so that they can include that in their evaluation of your medication regimen.
Is it important, you think, for people to keep a record of all of their medications, all their vitamins, all their supplements, and maybe even give a copy of that to their pharmacist?
Yes, it's very important to do that. And the reason why is, like I mentioned, there could be drug interactions, there could be duplicates. You could be taking something that you might not need, and they can make that call and look at your medication regimen and make recommendations to your doctor. I think in this day and age, we have a lot of different pharmacy options. We have a lot of different doctor options, and so to make sure that we keep it all in one place, that helps the pharmacist kind of look at that, like I said, on that higher level and make sure that you're not taking something that could be interacting, you're not taking something that could be harmful, and you're not taking something that maybe you don't necessarily need, or two different doctors have given you something that you might not, they may not realize that one has been prescribed by another one. So it's very important to have a full list so that your pharmacist can review it.
Many times we have to take an antibiotic, and I know we try to limit, and we certainly don't want to abuse antibiotics. But if we are taking an antibiotic, what are some of the common allergic reactions that our listeners should be aware of?
There's allergic reactions and then there's side effects. So for allergic reactions, that would be something like itching, a rash, in more extreme cases, throat swelling, shortness of breath, things like that. And then you have your drug side effects, which would be something like an upset stomach, nausea, diarrhea. So it's important to differentiate the differences between the two because, like you said, antibiotics are very important and they're to be taken with the utmost care. And we want to make sure that when we're taking an antibiotic that we don't list that we have an allergy to it if we don't in fact have an allergy. Because there could be a time in your life, later on in your life, that you may need that antibiotic as a life-saving measure. And if you've listed it as an allergy when really in the past you've only had, say, diarrhea with that medication, then it's important that they know that and we don't list that as an allergy.
When you look at sometimes the interaction with drugs and the risk of drug interactions, what are some of the most serious?
There's a lot that goes into that, which is why it's important to talk to your pharmacist. But one of the biggest things that people may not think of is that We all have different genes and different ways that our genes help us process medications. And so there can be sometimes some interactions with medications depending on how they're metabolized and how your body uses them. And so one could inhibit the other, one could enhance the effects of another. So it's very important that you have your pharmacist look at those medications because there could be interactions that you don't even know about. For example, sometimes if you're taking a blood thinner, you can, if you're put on, say, an antibiotic, that could enhance the effects or decrease the effects of that blood thinner and lead you to have a blood clot. So it's very important to let your pharmacist know when you're put on any type of medication so that they can check for interactions. And even things you may not think about, an herbal product could interact with the blood thinner, an antibiotic short term, even like an over-the-counter medication. So it's very important to let the pharmacist know.
Is it good to talk to your pharmacist about should I use a generic medication? And if I am using a generic medication, are there risks associated with it?
Generic medications are a great option. So they've gone through the same process that medications that are already out on the market have gone through. They're generally recognized as safe. The FDA has approved them and said they are safe. So there's generally not a risk to using a generic medication. Now, there are some instances where your doctor will write that you need the brand name of a product due to maybe, like we talked about, the way you metabolize the drug or those types of reasons. But your doctor will make that determination and they'll let the pharmacist know. So generally, I would say no. They're great options, and there are ways that your pharmacist can help with that in terms of looking for coupons and discounts and things like that. I know, for example, here at Parkland, we have preferred lists for our patients that are on our insurance plan, and that is out of the drugs in certain categories. We have a few that are preferred, and we encourage our providers to use those medications to help save our patients money and also to kind of streamline the types of drugs that we're using.
You know, to our listeners out there, let's assume they're having to use an eye medication and they're having a difficult time getting the eye drop to work. Or maybe they're having a difficult time swallowing pills. They can't read the labels as effectively as maybe they should. Should they talk to their pharmacist and get advice on that?
Absolutely. So that's a great thing that your pharmacist can help with. For the thing you mentioned about maybe trouble swallowing pills, so your pharmacist can actually look in to see if there's possibly a liquid formulation of that medication. So they could talk to your doctor about maybe switching that over. They could look into letting you know if that pill can be crushed or if it can be put in some applesauce or things like that. So they can make those recommendations for you. If you have difficulty reading the labels, they have options of making bigger labels or printing it out on a bigger sheet of paper. We can help with pill boxes, things like that. So there are lots of options that they can help out with if you're having issues with taking your medications.
You know, you just triggered a thought when you mentioned the pill boxes. Let's assume that you have an elderly parent, an elderly relative, and you're worried about them either not taking their medication or taking it too frequently. Are there things pharmacists can do to help to ensure that the patients take their medication appropriately?
Yes, so I mentioned the pill boxes. That's a great way to make sure that if a family member or someone that needs help is taking medications. With the advance of technology that we have right now, there are lots of options for drug apps that they have on your phone that can help remind you to take your medications at certain times. They can also track if you've charted down that you've taken it and things like that. Of course, there's always the old-fashioned way of writing down when you take your medications. And then just when you're refilling your medications and you're using the same pharmacy, which is something that I'm definitely would recommend, it helps us get a sense of if you're refilling on time, then that helps us see that you are using it appropriately. If you're refilling too early, you could be using it inappropriately, and that would help us triage and see if there's a problem that we could help fix, like you're mentioning with reading labels or getting the regimen down.
You know, many times when I go into a pharmacy, the clerk will say, "Do you have any questions for the pharmacist?" So let me reverse that a little bit. you are a pharmacist. Put yourself as the patient who is at the other side of the counter. What are key questions you think our listeners should ask when they receive a new medication?
Your pharmacist is required on a new medication to counsel you. So I would hope that whenever you're encountering a pharmacist in these settings, that they are counseling you. And when they counsel you, they should be counseling you on how to take your medications, common side effects, drug interactions. But if you do not receive that information, it's very important to ask. So I would say you need all of the top topics. So you need how to take it, any interactions you should be aware of, when you should take it. Sometimes it makes a difference if you take a medication with or without food, in the morning or the evening, before bedtime or first thing before you've eaten in the morning, and things like that. So if you haven't gotten that information, those are some things that you definitely should ask.
You know, along those same lines, especially to our listeners that are pregnant or expecting to be pregnant, is it a good thing to talk to your pharmacist about current medications you're taking?
Absolutely, yes, because there are lots of different caveats that go into pregnancy and wanting to become pregnant. I would first, of course, advise to talk to your physician about it, and then I would let your pharmacist know that you're planning to become pregnant or you are pregnant, because they're, like I said earlier, drugs are metabolized different ways when we have different things going on in our body, pregnancy being one of them. The other thing is important is there are different pregnancy drug class categories. There's extensive research that looks into see if it is safe for your baby, if it's safe for you, and then there's lots of caveats like this could be safe in the first trimester, this could be safe in the third trimester, and this applies to not just prescriptions but over-the-counter medications.
Such great information, and what a wealth of information with your pharmacist. We're talking with Cortny Anderson. She is the Ambulatory Clinic Pharmacy Manager at Parkland Health and Hospital System. And when we come back, as promised, she'll talk about the career side of this. If you would like to go into the field of medicine and possibly explore being a pharmacist, stay with us.
Covering the healthcare topics that matter most to North Texas. This is the human side of healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back to the human side of healthcare. We're continuing our conversation with Cortny Anderson, who is the Ambulatory Clinic Pharmacy Manager at Parkland Health and Hospital System. Pharmacists are an incredible source of information about all the medications, including over-the-counter, that we take. You know, often we don't think about tapping into this incredible resource. So let's start this segment by asking about expired medications.
As a pharmacist, I can't legally say that, yes, it is okay to take an expired medication. It's good to ask your pharmacist because there are certain medications that, say you got an antibiotic at the pharmacy that was mixed up by the pharmacist, that would not be something I would want to take out of the expiration date. There's some data out there about over-the-counter medications and things like that and how long they're good for, but in general, I would say that I would follow the expiration dates, and the reason they put an expiration date on a medication is because that is how long the manufacturer can guarantee that it is efficacious, which means it's still working. So that is how long they can guarantee that during that time period it is working. And outside of that time period, you can't be sure that the medication is still going to work at its what it was meant to do. So it's very important to still ask your pharmacist, and it depends a lot on the medication. So I would really seek out their counsel whenever you're looking into that.
You know, we interviewed a board-certified child and adolescent psychiatrist, and she told us that there is a real problem with young people, especially adolescents, getting into medications that maybe their parents have or siblings have, etc., and some are even overdosing on this medication. Can you talk to our listeners about how you should store medications safely?
Sure, and she's very correct. It is a major problem with especially our opioids and things like that are more serious drugs. So safely disposing of your medications, we have a couple of options. So if you watch the media and announcements, especially for Parkland, we have drug take-back days, which are days that you can bring all of your expired medications or things you may not be using, and we will dispose of them properly. Now, if it's a time where maybe you can't come to that, or you have some laying around that you really need to get rid of, so the CDC and the FDA have some good information on that, and I think a lot of what they recommend is to put them into a bag with something like soil or coffee grounds and mash them up and then dispose of them in a sealed bag. So that way it is kind of a deterrent from getting into those medications. So I would recommend coffee grounds. That's what we recommend for our patients. One thing I never recommend is putting a pill or a medication in the toilet. I know that's something that has been, I think, commonplace in the past, but we don't want our medications in our water supply because that can kind of taint it, even with treatment and water treatment. So coffee grounds, soil, things like that in a sealed plastic bag are the best way after they've been crushed up. So that's the best way to dispose of them. And then looking for local take-back days is also a great option.
So, Cortny, this is Thomas. I'd like to ask you about the career side of this profession. What is it like being a pharmacist, and how do you get there?
Right. So pharmacy is very diverse. So there's a lot of different career paths you can take. I've actually taken a couple different career paths. So first of all, to become a pharmacist, you have to go to undergrad for several years, and then you go to pharmacy school, which is generally a 4-year degree. It's a doctorate degree. And then you have a couple of options. We have pharmacists that work on the retail side. So that's like your pharmacists that you would see out at your Tom Thumb and CVS and things like that. And then we also have pharmacists that go into the hospital world, the clinical world. And this would be a pharmacist that would usually do extra training like a residency. So we have residency for pharmacists, which is something that I completed. You can do 1 to 2 years, 1 year being kind of a general, and then a second year doing a more a specialized residency, and that would be in a topic like critical care, infectious disease, cardiology, things like that. And then after that, we have pharmacists that work on both the inpatient and outpatient side. So for the people that I work with, they are providers in the Parkland clinics. So they see patients, manage chronic disease states. And then also I've worked on the hospital side. So you have pharmacists in the hospital, and I think I tell people this a lot. They tend to forget that a pharmacist even works in a hospital. So they play a very important role in checking interactions for your medications, making sure what the doctor's giving you is a safe medication, and things like that. Kind of the same thing they're doing on the outpatient side, but also while you're hospitalized. And that's just the tip of the iceberg. There are so many different ways that pharmacy can be utilized. I have friends that work in nursing homes. I have friends that work in industry for drug sales. I have lots of different. It's very, very diverse. So it's a great field to go into because you have lots and lots of options. One
other question. You were talking earlier about using just one pharmacy. And obviously, we know that some people, probably no listeners to this program, but some people use more than one pharmacy for purposes that are not the best, right? They're shopping meds basically around. How do you go about flagging that?
Yeah, so Texas and several other states in the U.S. have programs that are prescription drug monitoring programs, and these are specifically aimed at our more dangerous drugs that are like our Schedule II drugs like opioids and things like that, drugs of abuse. And that anytime you fill a prescription, that goes into that system. And so then the pharmacist can then log on, doctors, pharmacists, can log on and see where you've had your last prescription filled, and they can see how much it was written for and things like that, where you had it filled at. And so that helps us kind of combat some of that abuse and that doctor and pharmacy shopping, and help us hopefully kind of decrease the opioid pandemic and kind of fight that. So that's why I say please use the same pharmacy, because it's going to be displayed anywhere. So might as well just kind of stick to the same pharmacy.
Cortny, we're at the end of the program today, and you've been a fantastic guest. Great information. Is there anything you would like to leave with our listeners as we close the show?
So I'll get on my soapbox for a second. We are really pushing for our COVID-19 vaccines. So I really encourage, that's something that pharmacy is very involved in. So we really encourage getting the COVID vaccine as soon as possible to help stop our pandemic. And that's something that your pharmacist can answer questions about as well. We're very well versed in vaccines. We can administer vaccines, even more than just COVID vaccines. So that is a big thing that I hope to encourage everybody, and that'll help with our pandemic. We have lots of available options here at Parkland, and I know there's a lot in the community right now. So please, 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 make time to come get your COVID vaccine.
We really appreciate that. And, we've talked to different medical professionals, and, there are like 4 groups of people. Some people that are just anti-vaccines, period. Others that aren't really against it, but they're in the wait-and-see attitude. A third group, minorities and people of color, that understandably, because of past practices, are reluctant. And then, as I mentioned earlier, women that are childbearing years. Are you, in your profession, running a pharmacy and being the pharmacy manager for the ambulatory clinic? Overall, would you rate the vaccines safe?
Yes, I would rate them very safe. We have seen very low instances of side effects with the vaccine. And with the vaccine, you mainly see your side effects early on with the vaccine. It's not something that you generally see a side effect 10, 15 years from now. You're going to see it early on, whether that be an allergic reaction, those side effects that they list from the immune reaction, things like that. I would highly, highly recommend this vaccine. I know that there's a lot of misconception and misinformation out there about the vaccine. So I encourage you to do research, talk to your pharmacist, talk to medical professionals. Don't use social media and things like that to get your information, because a lot of that has been misconstrued. I spend a lot of time debunking myths that have come out about this vaccine. And I know it seems like it was rushed and that we got it out quickly, but that is because a lot of the drug development happened before COVID even started and this type of vaccine was developed. So it's good to know that, and to know that this is not something that was just thrown out there, that a lot of the steps that normally are taken with the drug were combined and were able to overlap. The manufacturing step was sped up and things like that. So it's really good to know that, and to really look for good sources of information, and not just what your social media posts and throws at you, but really seek out good sources of information.
Cortny Anderson, pharmacist at Parkland Health and Hospital System, thank you so much for that great information. And a big tip of the hat to all of you dads out there. Happy Father's Day. We wish you a great and safe day with your families. And aren't we glad that this Father's Day looks a whole lot different than last one? We'll see you all next week on The Human Side of Healthcare.